Aronson from the Texas Tribune. Women in the Rio Grande Valley don't really have access to abortion services right now or many family planning clinics. They must travel to San Antonio or Corpus Christi to get access to those facilities. As a result, researchers have said that they do see a higher rate of women in that area of the state seeking illegal drug-induced abortions.
Welcome back to State of Texas In Depth. A year ago, lawmakers battled over an abortion bill inside. Here on the south steps of the state capitol outside, a massive crowd had gathered by midnight. For the filibuster, time was up. Democrats had won temporarily, and they also had a new star, now their nominee for governor. Here to talk about that night and the aftermath for women's health, two people on the front line during the legislative session. Representative Donna Howard is an Austin Democrat and former nurse, and Representative John Zerwas is a Houston area Republican and also a doctor in his home district. Welcome to both of you. Thank you for joining us. Back in 2011, there were some cuts to family planning and women's health. Some of that money was restored in 2013, but was it enough from what you've seen in the year since last year's session?
Well, both Dr. Zerwas and I are on appropriations and worked on that, and I feel very proud of the work we were able to do to restore funds. Certainly the cuts that were made were unprecedented the session before and resulted in the closure of what looks to have been over 70 clinics. So restoring funds was critical to try to get those services available for women. The difference, I think I would say, is that we restored the funds to some different programs that aren't necessarily as cost effective, and we're not currently seeing the number of clients that we saw before the cuts.
Yeah, I think what we have seen is, Representative Howard's correct, we actually restored more than what we cut in 2011. And I think that was the right thing to do. We needed to really make sure that these services were available to women who fall into the various income levels. What we have is a multitude of programs, actually. Some are lesser funded, some are federally funded primarily, but they're all focused on, improving the health of women and hopefully improving outcomes of newborns and things of that nature. I'm most pleased with, I think, at least the funding of the primary care program that we put in place, that where the commission came and asked for $60–70 million to do this. We actually said, no, we want you to take it a step farther. We want this to be a robust program. We want you to spend $100 million on this. So I think we're yet to see, are we in fact meeting the needs? Do we in fact have an adequate network in place? I'm encouraged by the numbers I see in terms of network adequacy and of access. But at the end of the day, we've got to be sure that the women are in fact getting the services that we have put in place. Partly to recover from the 2011 cuts, but partly really to move the ball forward.
Because the population is obviously growing. The Center for Public Policy Priorities says that now the majority of impoverished households in Texas are led by women, and we know that more than 500,000 girls under 18 don't have health insurance. How do you keep up with that next session?
The fact is, we've seen here locally in Central Texas the closure of the Lone Star Circle of Care clinics, and that shows you how fragile our provider system can be, because that's now having ripple effects on what's happening here in Austin. And what we thought were going to be providers that would be available to some of these women are not going to be available. So we took a system that was working and we defunded it in order to prevent one of our qualified providers from participating. And in return, even though we've put money back in and more, as Dr. Zerwas says, we're putting it out there in a different way that is less cost effective, and I'm not convinced that we have the providers at this point. So I think that is critical, especially in light of what you bring up, but that we have so many women who are not insured and need this kind of care.
With regard to the abortion clinics that have had to close since the bill that went through in 2013, many of those clinics, offer other services beyond abortions, HPV screenings, STD screenings. Do you feel like that the legislature might consider funding those clinics if they don't do abortions?
There clearly is a very bright line on the issue related to abortion, and it was manifest during the last session and special sessions thereafter. And so, you know, I think that clearly what the state is interested in, and Representative Howard has mentioned, how do we provide the most cost-effective services for women? How do we get them enrolled and plugged into the system? As mentioned, we have the resources, and I think we're going to continue to have resources beyond what we even had last time. The more that we can save and deliver care in a very high-quality way, the more the state overall is going to benefit that in a number of ways outside of health care.
But I think it's important also to remember that the laws that were put into place last summer with HB 2 were sold as being done to improve the health of women and the safety of women, when in fact the Texas Medical Association, the College of Obstetricians and Gynecologists, the Texas Hospital Association, and even our state health services did not have any, showed that there was no evidence to support that we needed to make any of those changes. There was no legitimate medical reason to make any of those changes. This was more of an obstruction of access to a safe and legal procedure.
If the law actually limits abortions and doesn't ban it, is there the possibility of funding those clinics to the point where they can do those upgrades to become ambulatory surgical centers?
Well, I think that's assuming that we need to do that. And again, I know Dr. Zerwas is saying, you know, we look at what's demonstrated and what works. What we had before was had demonstrated its safety and efficacy in providing this. This was, the ambulatory surgical center is a solution in search of a problem that did not exist. So just because something has wider hallways and more bells and whistles doesn't mean that it's necessary for every procedure that's done, especially if it's already a very safe procedure, as abortion has been in the clinics that already existed. I think it's also important to remember, though, that as Dr. Zerwas is talking about, not one penny goes to abortion, not one penny of government dollars goes to abortion. And as he said, what started this thing in the previous session with the cuts in family planning was to do kind of what you're talking about, to separate those facilities that had an affiliation with an abortion provider. So for instance, Planned Parenthood has programs that are not associated at all. They have separate budgets, separate boards that offer women's health care and no abortion. But because they have the same name, because they are connected out in the community, the decision was made by the majority of the legislature, I did not agree with, to prevent Planned Parenthood from being a part, even though they're a qualified provider, a part of delivering family planning services because of exactly what you're talking about. They provided the preventive care, were not providing the abortions, but they had enough of an association that some people felt that was not appropriate.
All right, well, you two are on appropriations, so I'm going to come back and talk to you guys in 1 year.
Great.
Terrific.
Thank you.
Great. Thank you.
Thank you very much.
Thanks.
Coming up on State of Texas In Depth.
The honor that I've had to serve you all over the years will come to an end in December.
He'll soon leave office, and he led the Senate during the heated abortion debate. What Lieutenant Governor David Dewhurst says could have changed it all. Next on this special edition of State of Texas In Depth.